My name is Laura Serbu. I'm a preventive medicine doctor as well as internal medicine doctor. I love talking about prevention and all things related to prevention. We'll talk about why we screen, who decides about screening tests, and then the majority of the talk will be talking about different screening tests, in particular, if there are any screening tests available for prostate cancer, pancreatic cancer, and brain cancer. Why do we screen? These are the three main reasons why we screen typically. And it's good to keep this in mind for any condition like a cancer, because essentially either the cancer itself or the screening tests that we have available don't really fit into these three main requirements in a sense, then there may not even be a screening test, and we'll talk about that later. So why we screen, we want to catch a condition early. We want to be able to treat and even cure. So we need to likely have medicines available or surgery available to treat and cure the disease. And for the main reason, of course, is to prolong life, to try to have people live longer, healthier lives. Who decides about screening tests? There are different groups that give their recommendations on screening tests, but the main group in the United States is called the United States Preventive Services Task Force. The acronym is long, it's USPSTF, and they're made up of different doctors and from different fields in primary care, so internal medicine, family medicine, pediatrics or kid doctors, obstetrics and gynecology, and they all review the available research and data out there to say, we have enough information to know that this screening test would be helpful, and so we recommend for doctors to do. They can only comment on the available data that's out there, the available research that's been done, and so if there isn't any research out there, they can't give a recommendation, and that will be applicable. I'm putting the stoplight on the side here because if you were to go to their website, which I recommend doing if you have the time, it's unfortunately geared toward clinicians and doctors, but essentially their recommendations are split up into different letters. So a green recommendation is like green means go ahead and do this recommendation. We have a lot of research and it would be worthwhile to do. However, there are different letters, such as a C, which is sort of like a yellow light, meaning like proceed with caution, make sure that if you were to do the screening test, you talk about it with the patient, you figure out if it's worthwhile for them based on what they prefer and their own values. And then a D letter is actually like a red light, like don't go. The equivalent is like, don't do the screening test. It actually does not help. It causes more harm. And so I mention this because with some of the screening tests, I'll use this lettering system. And just for you to know, in case you were to go to that website, and you can look for yourself what kind of screening tests are out there and what they recommend. The first test that we'll talk about today is for prostate cancer. This is just an image of a male body if we're kind of looking at it from the side. And so at the top here, we can see two kidneys that are connected down here to the bladder by like two little tubes. And the prostate, as a quick review, sits underneath the bladder, and the bladder holds on to the urine before exiting through the urethra and ultimately through the penis. And so the prostate kind of hugs that urethra or that tube that lets the urine exit the body. With that in mind, like if the prostate is enlarged, for example, it can push on that tube and prevent urine from going out. And so that's why if someone has an enlarged prostate, the acronym for that is called BPH. That can cause urinary symptoms, trouble with peeing. Who is eligible to be screened? It's for men ages 55 to 69, but it's not recommended for men over 70 years of age. And that's because the data and the research has shown that in that age group, screening is not helpful. And the type of screening test that is done, it's a blood test. It's called prostate-specific antigen test, or PSA. And if it's above a certain level, then that's concerning that there could be something going on with the prostate. We don't really have great data on how often to test for the prostate-specific antigen, or PSA. And so the USPSTF group recommends periodic testing, which is not very clear. I mentioned before the enlargement of the prostate as an example of what could be happening with the prostate, because PSA is a blood test that's specific to the prostate, but it's not specific necessarily to cancer. I remember what a urologist once told me, that the prostate can be having any number of things going on. It could be enlarged, it could be infected, it could just be like working extra hard doing prostate prostate things. And so the prostate specific antigen just shows that something's going on with the prostate, but it doesn't necessarily mean cancer. So that can be confusing though for a doctor or a patient, because if the blood test, PSA, is above a certain level, then there has to be more investigation as to what's going on. And that investigation could involve a prostate biopsy, or taking a little sample of the prostate to take a look at it under a microscope and maybe see what's going on. And unfortunately, the prostate biopsy is not fun, to say the least. So that's why when the USPSTF group looks at the data for screenings, they take into account what are the risks to screening, how harmful can the screening test be. Thinking back about the letters that I talked about earlier, this first bullet, screening for men ages 55 to 69, that's a C recommendation. So it's a yellow light, which means for doctors, talk to the patient, see what their preferences are, and see if a prostate screening works for them and is something that they would want to do based on their values and their preferences. But for men ages 70 and older, it's a D recommendation. So it's a red light. It's do not do the screening test for this age group. There are some issues with screening for prostate cancer. I already mentioned prostate biopsies are not fun. After a prostate biopsy, people can have some symptoms of blood in the urine for several days. There's the risk of infection of the prostate, and those are the main two, but there are some other risks involved. And the main issue though is that once we take some cells from the prostate and look at them under the microscope, we can find parts of the prostate that may be concerning for cancer, but it never develops into a serious cancer. So it could be a false positive. Essentially, with this false positive, or maybe more specifically in the cancer realm, I'll use this analogy of a turtle, a rabbit, and a bird. So hopefully this will make things a little less confusing. So there are many different types of cancer out there, and we can use the turtle and the bird and the rabbit for kind of the different speeds of cancer. So if we just imagined like having a farm and we had these animals on the farm and we kind of wanted to catch these animals, we can catch a turtle, right? They don't go anywhere. They move very slowly. We're going to catch them no matter what. A rabbit, we kind of have to put in a little extra effort, and sometimes we might not catch it initially, but sometimes we do, and that's the middle animal. But a bird, like in reality, are we really going to catch a bird? Probably not. It's really hard. I've never caught a bird. I've never tried, but just keeping this in mind, there are different cancers as well that have these speeds. So there's a cancer that moves super slowly and in all honesty will not be causing any problems for this person. They may be dying with the cancer, but not because of the cancer. And then there's a bird that unfortunately moves so fast, so quickly that really the time from the symptoms starting and unfortunately the time for that person to pass can be very short, weeks, months. And so a screening test, even if we would have wanted to, probably wouldn't have caught that cancer diagnosis in a way that could have been helpful. But the rabbit actually is the cancer that we are most looking for, the one that we can find, that we can treat, we can catch, but not all cancers are like this, unfortunately. And so for prostate cancer, a lot of the cancers that are prostate cancer are more in the turtle category. Many men live with prostate cancer, but they don't die from prostate cancer. And so the screening tests were actually causing more problems because we kept finding more cancers, and then doctors felt like they had to do something about it, surgery or chemotherapy or radiation. In reality, those cancers would have not caused any issues, but we're learning more about that now after getting more data and more research, but we didn't know that as much before, like several decades ago even. But I'll be using this, turtle, bird, rabbit analogy for some of these other cancers as well. So for pancreatic cancer, so as a quick review, the pancreas is sitting here in the middle of the abdomen. It helps with digestion. It helps with the sugar levels in the body. However, pancreatic cancer is very rare and unfortunately can be deadly as well, can be very serious. This is in part because we do not have good treatments for it, and it's hard to catch it early. It moves very quickly, and so it's hard to catch it early and then to treat it. So we actually, unfortunately, don't have a screening test that's recommended for pancreatic cancer, and so it's not something that your doctor is going to talk to you about at your yearly physical or your yearly early well visit. We don't have evidence for imaging tests to be helpful to find it early, and it's more likely to find, as I talked about previously, these false positives, like we thought it was cancer, but then we looked closer and it's not cancer. There's stress surrounding getting a test result that might be cancer and then it's not. Like that's a lot of stress for someone to go through. And so as of right now, we don't have the tools to catch it early. We don't have the tools to screen for general population in a way that's helpful. And so there's no recommended screening test for it. And so with that in mind, pancreatic cancer is more of a bird. It moves really fast. And so that doesn't give doctors time to find it and to do something about it. Last but not least, brain cancer. So brain cancers, similar in a way to pancreatic cancer, can be pretty rare. It doesn't happen very often. And some are dangerous, but some are not. So there's a medical term that you've probably heard about, which is tumor. So tumor just means growth. It doesn't necessarily mean that it's bad growth or good growth. And so a brain tumor, just like other tumors that are out there, some tumors can cause problems and some tumors don't. For the ones that are dangerous or maybe like is a bad tumor or is a bad cancer, we don't have good treatments for the ones that are very serious. And it's also hard to catch early. Similar to pancreatic cancer, the USPSTF does not have a recommendation for brain cancer screening. What they also keep in mind is after the screening test, kind of what could happen next. So unfortunately with the brain, as we know, the brain sits in our skull, thick bone that surrounds the brain. And if we were to find something that is concerning for brain cancer, but my understanding is that in a lot of cases, we'd actually have to remove part of the skull to take a sample of that part of the brain. And again, look at it under a microscope, see whether it's cancer or if it's just something that's growing there and won't cause any harm. But to have thousands or hundreds of thousands, tens of thousands, hundreds of thousands of people go through that for something that may have not caused any problems at all down the line can be very harmful. So that's what's kind of kept in mind when talking about screening tests as well. Like, what's the next step? Will it be helpful? Are we prolonging life? Again, the last comment about brain cancer is that a lot of the cancers are birds, like they move very fast, they move very quickly, and unfortunately there's not time to do surgery or do radiation or do chemotherapy and save this person's life. And some of the brain tumors are harmless. They're there, they don't cause any problems, they're never going to cause any problems for this person. But again, if they were to show up on a brain scan, there may need to be next steps done, which could be more harmful than beneficial. Screening tests are prevention and vaccines are prevention too. We're trying to prevent a disease from occurring, or we're trying to prevent a disease from progressing, and vaccines fall into that bucket as well.